Welcome to Insight, the podcast bringing you the latest in eye care, treatments, and what symptoms to look out for.
So I'm now joined by Farah Ibrahim, and we're going to talk all things diabetes. So diabetes affects millions of people around the globe and hundreds of thousands of people here in Ireland. So could you tell me, how can diabetes impact your eyes?
So diabetes, when you're diagnosed, what it means, your body does not produce or does not respond to insulin, our hormone that transport glucose to your blood vessels. So this leads to damage to the blood vessels itself throughout the body, and including the small blood vessels at the back of your eye. And this can lead to a condition called diabetic retinopathy that can cause blindness. So it's a serious complication.
Is there any symptoms? So if I'm a diabetic, would I know that I had that my eyesight was starting to be affected from the diabetes? Would that be something that I would notice?
Actually, at the beginning, no. So that's why it's important for you from the moment you're diagnosed to have regular eye checks and eye examination, because at the beginning, until the condition actually progresses, the damage won't be evident and you won't have any symptoms at all. As the condition progresses, then you can get signs like dark or floating strings in your visions, reduced visions, or vision loss. But any change in your vision, you need an immediate eye check.
So would you recommend, and again, for people that have diabetes, how often should they go and get their eyes checked? How often should they go to ensure that their, prevention is better than cure? And for you to catch it earlier, you want to be able to, they need to be seeing their optometrist or coming into Veonet Ireland to ensure that they're seeing a consultant that knows their eyes. So how often do you think they should come and have their eyes checked?
So this condition affects your eyes at stages and different severity. So at the beginning, normally we advise this once a year.
Yeah.
And following on from that, you can follow the advice of your monitoring eye consultants. Or in Ireland and the UK, they're actually government-funded diabetic retinopathy screening programs as well. So it's advisable at least once a year. And if there's any changes detected, then you follow the advice following on from that.
It's like a silent killer, not a silent killer, but it can silently really affect your eyes if you're not getting them regularly checked. So along with the screening, what else can I do that could help improve my vision if I'm diabetic or help with my symptoms? Is there anything I can do?
So at the beginning, the main thing is diabetes is a condition that affects multi-organ. So the big thing with diabetes is a discussion with your GP and your endocrinologist, your diabetes doctor, in other words.
Yeah.
And so you know yourself at what stage are you at as an overall disease control. And advice from your dietitian is crucial. So healthy diet, managing your blood sugar levels, your blood pressure, your cholesterol, and obviously not smoking helps.
Yeah.
As in a way it will affect your blood flow, even from smoking perspective. So it definitely reduces the effect on your blood flow and the effect on your blood vessels from that side of things. But what other things you can do is obviously regular exercises and be well informed of your control, especially your HbA1c. If you can find out, please do. So it helps your GP to guide you further.
So how do I find that out?
It's actually a blood result that will be done for you. regularly. I think every 3 to 6 months, depending on how your control is and how you monitor it.
Yeah.
And it's always good to know where you are at. And there's no harm asking the doctor, what does it mean? Does it mean I have to control it better? What number am I aiming for? So it's usually a discussion with your endocrinologist and your GP from their side of things.
Super. So if I have diabetes and I've started to, I've been doing all the right tests, I've been eating well, but I can still start to see a change in my eyesight. What's next? What's the treatments available to me? How can I treat or hopefully stop me, from my eyes degenerating?
So there are treatments for diabetic retinopathy. There's two conditions that we specifically look out for. So diabetic retinopathy, where there's changes in the blood vessel itself, but also diabetic macular edema, where you can get fluid leakage at the back of the eye. So for treatment of this, it would involve either laser treatment or intravitreal injections for the back of the eye. And on top of you monitoring and getting a tight control of your blood sugar. Because at the end of things, it doesn't matter what I do, what we do as eye doctors, but your control needs to be good in order to control the disease so it doesn't keep progressing. But there are also surgery that we can do if the condition progresses to help prevent further vision loss.
So is there anything new? I mean, you, again, working at Veonet Ireland, everything is about, making sure that the patient has access to the best care close to home with the best consultants, of course, which we're speaking to now. But is there anything that Veonet Ireland are doing to look at, the treatments that are coming, the innovation that is coming in diabetes? What is sort of, that's helping to restore vision sooner?
So at the moment, I'm very fortunate to be working with Veonet Ireland. All of my colleagues in Veonet Group are very proactive at looking at innovations and collaboration, and we are having international discussion as regularly. So I am involved myself with the medical retina expert group, which consists of experts from the Veonet Group, from Miranza, from iScan, from Vista. So we discuss about new innovations, but also what everybody thinks in form of data evaluation. As a group, will we adopt these technologies? And from the point of diabetes specifically, at the moment, there's the anti-VEGF, there are more biosimilars coming out. There's talk about a new delivery system for intravitreal injections using the port delivery system that is coming out. And also in the pipeline, there's some gene therapy that's in trial in the US. So there's ongoing, always innovation to effectively reduce treatment burden to patients.
And you talked about sort of, again, I'm sure people that are watching this would want to know, and that they may understand, but for me, understanding the types of injections. So I don't know if you can explain a little bit more about if they were going to this treatment of injections, what are they and what are they there to do? What are they going to improve?
So the injection that we talked about for diabetes specifically is what we call intravitreal injection, where at the moment we're giving the anti-VEGF medication direct into the eye. And this is because, if you ask me why can't I take a tablet for this, it's because the eye is involved in what we call the blood-brain barrier. You can't just, the drug that you take into your system cannot pass this barrier effectively. So we have to inject the drug directly into the vitreous. And it has been proven to work. I know it sounds as an injection, it scares people, it's scary, but it does work very well. And it is a treatment that actually at the moment has been proven that if we control the fluctuation of the retina, like in cases of fluid at the back of the eye, that we keep the fluctuations of the swelling of the retina stable, it can improve the long-term vision, from the point of damage to retina itself. It's basically effectively you're drying out the film of the camera with the injections. That's for macular edema. But when you have blood vessels at the back of the eye, the medication also works to actually regress the blood vessels. It stops the drive for the blood vessel to grow more. And these blood vessels are very fine and new. They shouldn't be there and they can bleed.
Yeah.
So you don't want a pool of blood at the back of your eye.
Yeah.
So this is what the drug does for you. And it does work really, really well. All the studies have shown it. All the real world data has shown it. So don't be scared of the injection. We numb the eye, obviously. And it's a very quick injection. And we try at the moment, all the innovation are trying to prolong the intervals that you need the injections. That as long as you don't need it, we won't give it to you. But there is some regular frequency to it if we need the treatment ongoing.
And what would that be? So, if I'm in that treatment program and you've injected my eyes, I've seen that improvement, as you've touched on, is it something that I need, every 3 years, every year, or is it dependent on the patient and where they are within their journey?
For diabetes, it's a lot of it dependent on how the disease is, how the disease progression. And amazingly, if you control your sugar better, it does help the eye. It does make you less need the treatment.
Yeah.
So a lot of it is disease control, blood sugar control, blood pressure, cholesterol.
So with the injections, is it something that's halting the degeneration of the eye or the bleeding of the back of the eye? Or is it actually treating it and regressing it back? Is it making it better?
The treatment doesn't cure the progression. I've seen patients who has had diabetes for 40 years with good glycemic control, sugar control, and the eye is perfect. But then you can have a patient who's been diagnosed for 2 years, have very poor control, and so many complications from diabetic retinopathy. So at the end of the day, it's the overall control matters, regardless of what we do. It halts it, it supports you. The way I say to patient is we support you while you get control of your blood sugar, and then we can help you from then on. So the treatment with the injections are, at the moment, honestly, all of it is short term. Nothing lasts forever. The drug doesn't last in your eye forever. You can get laser treatment for the blood vessel formation. That has been shown that that's more effective as a permanent measure, but still, there's only so much laser you can do.
Yeah.
Even when we talk about the surgery, and for diabetic eyes, it's usually the last resort, and it's when there's a lot of blood at the back of your eye. We have to clear the blood to give your vision back, and it's not something that you want if you can avoid it. So the main thing is keep your blood sugar control well, don't smoke or stop smoking, control your blood pressure well and your cholesterol well, and have a really good relationship with your endocrinologist or your GP, or your diabetic doctor, whoever is managing your care, and also follow your dietitian's advice.
Yes. I've been having my regular eye checks with my optom or my endocrinologist. And I need to come with further diagnostics with the symptoms, with the symptoms that I'm having with regards to my diabetes. What kind of equipment do you use? How do you diagnose different issues that can occur due to diabetes?
So for diabetes, as you know, it's a visual diagnosis almost. So we're looking for two things. One, we're looking for new blood vessels forming at the back of the eye that sometimes the optician can see and by the slit lamp examination, and the other one is looking for the fluid at the back of the eye. So because we literally can see this, it's only ophthalmology has that privilege. We can see the problem immediately. So the diagnostic that we use that is slightly different is we would have the OCT machines that also the optoms might have, most optom do have now, where you can see the fluid at the back of the eye. But we also have an OCT angiography with our machines in clinic where you can see the new vessels formation as well. We also have the Optos machine, which gives a wide field view of the back of your eye. So this is important for the peripheral changes, especially for new vessels formation. And we can do a dye test with that will show if these vessels are active. That means you need further treatment. And that leads to the treatment such as, let's say, laser treatment, which is pan-retinal photocoagulation, that you need the laser machine and the expertise to have the treatment, and also the anti-VEGF intravitreal injections in clinic.
Okay, so if as a patient I want to come and see you, where can I be treated? Where can I be treated? Where can I come and see you?
So at the moment, I'm currently based in the Veonet Ireland Cork clinic, and I have colleagues working in the Veonet Ireland Carrick Mines clinic. So we would have the same machines, diagnostics, and also capabilities to treat you.
Super.